Hello, my name is Dr. Beechar. I'm one of the directors of Medlighten Medical Education. Today's video is about signposting. So what we're going to cover is when signposting is appropriate and when it's not appropriate, and the types of phrases that might be helpful in different circumstances. So when is signposting appropriate? It's appropriate if you want to ask a personal question, a sensitive question, or a question which makes sense to you as a doctor but wouldn't make sense to a layperson. So let's start by talking about each of these three scenarios, and then we'll talk about when signposting isn't appropriate. So signposting is a very good way of building rapport when it's used correctly. So if we start with sensitive questions, what sort of signpost could we use? If, for example, you have someone with heavy periods and you're wondering if the underlying issue is an STI, you could say, sometimes these symptoms can be caused by sexual infection, so is it alright if I ask some personal questions? An alternative is, for example, say you have someone with very painful periods and you're wondering about endometriosis, and you want to know if they have superficial or deep dyspareunia because they've said they've got pain on sex, then the way I would signpost that question is, Mrs. Smith, is it alright if I ask you a very personal question? The reason is, it would help us narrow things down and it may help us come to a diagnosis. Could I ask, is the pain when you start having sex or is it when your partner's all the way in? So that's a very personal question. I've signposted with giving the reason why I need that information because it will help me come to a diagnosis. And then I've said, could I ask? So again, I'm being very polite when I ask the question by using the phrase, could I ask? Or an alternative is, may I ask? Now, the next time you may want to signpost, it was when you were asking a sensitive question. For example, you're asking a mother with postnatal depression if she's got thoughts of harming her baby. So what I would say in this circumstance is, Mrs. Smith, I'm sorry to hear how much you're struggling, and as I've said, there should be a lot we can do to help. But this is something we'd ask any mother who's struggling as much as you are. Have you had any thoughts of harming your baby? Because if you have, there's a lot we could do to support both you and your baby, but it would be important for us to know. So I've normalised it by saying this is something we'd ask any mother, and I've also added that there's a lot we could do to support her and her baby to help encourage her to open up. So that would be an appropriate signpost for a sensitive question. Now, the third thing is where a question seems unusual to a patient. So what do we mean by that? Well, we mean if a question makes sense to you as a doctor but wouldn't make sense to a patient. So let's go through two examples. One, acne. If you have someone with acne, as a doctor, you know that hormones can affect acne, but not all of your patients will be aware of this. So a good signpost could be, Mrs. Smith, sometimes acne could be caused by a hormonal problem. Are your periods regular? So sharing your understanding with the patient. Now let's take a second example. Imagine you have a patient who's got left iliac fossa pain and you're suspecting an ectopic pregnancy and you want to ask about shoulder tip pain. Now, if as a layperson I come and see the doctor because my abdomen hurts, I would be very confused if the doctor then started asking me about shoulder pain. So a good signpost, if you can't think of anything else, is, I know it sounds unusual, but it might be related. Have you had any new shoulder pain since your tummy pain started? Now, when is signposting not appropriate? Over signposting can affect your rapport negatively because it can affect the flow of the consultation. So, for example, you don't need to signpost to ask about trauma in back pain because someone who's got back pain would be expected to be asked about injury. Or you don't need to signpost to ask about a patient's skincare routine in acne because if I have a skin problem, I would expect questions about my skin. So if a question would make sense to a layperson, isn't personal and isn't sensitive, you probably don't need to signpost.